Well, I suppose the major expansion at Ennis Hospital is certainly welcomed for the county. The 48-bed ward block with additional theatres and recovery space, and that's at detailed design stage, so it's well on track. Also, I suppose the investment in community nursing, the likes of St Joseph's and step down care. Is very welcome, as well as the Bushy Park investment in addiction and mental health treatment facilities upgrading. But I suppose as well as that, we have to take it in the context of the Midwest and the investment in UHL from the point of view of things like the surgical block, surgical facilities, and the cancer services as well. So, and I suppose the continuing need to invest. I suppose it's all within what can be done in the short to medium term, with the long term view of securing an A&E for the county. But in the meantime, these facilities, I mean, we have a growing population. We're under resourced in UHL serving the region as it is. So all of these are certainly not going to replace any plans for the A&E in the new A&E in the Midwest, but simply trying to play catch up at this stage, because I suppose it's estimated that we are about we are significantly short of beds in the region. That's certainly been well documented, recognised, probably, in the region of 300 to 400 beds short of where we should be in terms of acute care. But also, I suppose, from the point of view of ensuring that we have services available at Ennis, that people would not need to travel to UHL for services as well.
And when we
I
read
suppose the
about
recognition
plans,
as well that we have an ageing population, so that investment in step down care and elderly care is very important.
when we read about plans for the expansion of Ennis Hospital today, is that in any way discouraging? Does it suggest to you that an expansion, or rather the expansion that people are looking for, i.e. an emergency department in Ennis, isn't being seriously considered, or would you see the two as unconnected?
I see them working in tandem, because the reality is a new A&E is going to take time. It's going to take years in terms of planning and finding that site, locating that site, planning everything that needs to go with it, the infrastructure that needs to go around that. So these projects I would see as very much short to medium term, and have to be invested in. And we have an aging population, as I said, but we've also a growing population, and we're also already operating under capacity. So we're playing catch up, and I would say that this investment is to get to that level in terms of catch up for where we are at the moment. But if we have to future proof our health service, we certainly need that A&E in County Clare to facilitate a growing population and a changing dynamic in terms of how healthcare is delivered, and the range of services and the type of services. So I would see them working in tandem, because we certainly, you always need continuous investment and upgrading anyway, outside of the fact of a new A&E. So this continuous investment is expected and needed and required, external to that need for a new A&E in the region.
And just on University Hospital Limerick, of course, €61 million going towards that facility today. We heard Bernard Gloucester just this morning, the CEO of the HSC, saying that UHL has turned a significant corner when it comes to overcrowding. Would you agree with that sentiment, or do you see any evidence for that?
Well, it's certainly, they have been, they're doing a huge amount of work there, and they're very dedicated staff and management there that are looking to turn that corner. And improvements certainly have been made in terms of wait time, in terms of trolley numbers. But I suppose it's too early to tell in terms of consistent pattern. It's going in the right direction, but it has to keep going in that direction and keep declining. So certainly huge inroads have been made, but they need to continue to do that in order to I suppose, regain that confidence back in the region in terms of UHL, which I think is where they're going, and also I suppose to have that consistent level of care, and that people get familiar with using that care and being confident and reliant on it. Facilities like the medical assessment unit and the small injuries clinic have seen huge increases in their usage, more so that people have become familiar with them and become confident in them and become reassured in them because their experiences have been good. So the more people that are using the medical assessment unit and the small injuries clinic in Ennis have had a very good experience and are continuing to use it. So those services need to be expanded and continued. So it's all about getting services closer to the patient and ensuring that the people of Clare and the remote parts of the county get access to care in a timely manner. And that also extends to the ambulance service. And there is good news on the horizon in terms of the expansion of the ambulance service, both from a facility perspective in the region with a new base in Limerick, but also in terms of numbers, in terms of staffing numbers. We're seeing good numbers coming, allocations of more staff for the region in the ambulance service, which is very welcomed, because again, when you live in remote areas of the county where you're far away from UHL, access to care and delivery of care as close to the patient, as close to the incident as possible is what's key.